So can you reaffirm what the screening process is like for patients?
The screening process is a low-dose CT scan, and what I mean by that is a smaller amount of radiation than a typical CAT scan. So the images show up, it's a lower dose of radiation, and we use that to determine if there are
Any
risky nodules, any risks that we see, any nodules, the appearance of the nodule, enlarged lymph nodes, and then we use that to determine whether or not the patient needs further testing, such as a PET scan or to see a physician or a surgeon.
Even with a low-dose CT scan, are still risks to doing doing that kind of CT scan?
The cumulative risk over the course of a lifetime for radiation from the CAT scans is a significant potential problem that we want to avoid. So while we do the tests that are appropriate, it's not appropriate for every person to be screened for lung cancer. There are certain risk factors that we take into consideration that we saw in that earlier video.
Now, what about false positives? Is this something that can happen with a like a CT scan?
Correct. It can happen. There are nodules that show up in many patients that are completely unrelated to cancer. They can be benign nodules or related to infection, inflammation, those kind of things. In fact, if we put every person through a CAT scanner, we would probably identify nodules in the lung between 80 to 85% of people. Almost all of those nodules are nothing to be concerned about.
They're all benign.
Almost all of them are benign. It's the very small patients with risky nodules, and that has to do with the appearance of the nodule as well as the patient's history, whether or not they're a smoker.